Hi everyone, welcome back to my YouTube channel, and today we are going to talk about radicular cyst. So let's start a topic with introduction. Radicular cyst, also known as periapical cyst, is the most common type of odontogenic cyst. It arises from epithelial cyst of malices in the periodontal ligament as a result of chronic inflammation following pulp necrosis. Radicular cysts are typically asymptomatic, discovered on routine radiographs, but may cause swelling or pain if secondarily infected. Definition: Radicular cyst is defined as a pathological cavity lined by epithelium located at the apex of non-vital tooth, filled with fluid or semi-fluid material and arising from chronic periapical inflammation. Etiology: Radicular cyst develops primarily due to chronic periapical inflammation. Common causes include pulpal necrosis, that is most common cause. Bacterial toxin formed necrotic pulp stimulate epithelial proliferation. Second etiology is untreated chronic periapical granuloma. Chronic granulomatous tissue may stimulate the epithelial rest to form a cyst. Third etiology is trauma, as luxation or fracture causes pulp necrosis. Fourth etiology is iatrogenic factors, as incomplete root canal therapy or coronal leakage allowing bacterial infiltration. Pathophysiology: Necrotic pulp releases bacterial toxins to periapical tissue. Chronic inflammation then stimulates epithelial rest of malices to proliferate. Central cell of proliferating epithelium degenerate, forming a cystic cavity filled with fluid or semi-fluid material. Cysts enlarge slowly, causing bone resorption and sometimes displacement of adjacent teeth. Infection may cause acute exacerbation resulting in pain and swelling. Clinical features: First are symptoms. It is usually asymptomatic and it is detected on routine radiographs. It may present with swelling, mild tenderness, or pain if secondarily infected. Tooth is usually non-vital in this case. Second, we can do is tooth examination that involves percussion that may reveal mild tenderness, and slight mobility is present if lesion is large. There is no pus unless secondarily affected or infected. Then there are other signs that may include facial swelling in large cysts, and occasionally there is displacement of adjacent teeth or root resorption. Radiographic feature: Radiographically, if we will see well-defined periapical radiolucency at the apex of non-vital tooth. Borders are usually corticated, indicating slow growth and chronicity. Size may vary from a few millimeters to several centimeters. Differentiation from periapical granuloma may require histopathology. Histopathological features: Cystic cavity here is lined by a stratified squamous epithelium. Fibrous connective tissue wall with chronic inflammatory infiltrate is there, containing lymphocytes, plasma cells, and macrophages. Occasionally, cholesterol clefts or dystrophic calcification may be present. Rest of malices are often seen in cyst wall. Differential diagnosis: Periapical granuloma is smaller, non-epithelialized lesion. Radicular cyst may be differential diagnosis, that is remain after extraction of causative tooth. Even in that case, odontogenic characteristic is a more aggressive and may extend in bone. If we talk about periapical abscess, it has acute onset, pain, swelling, and pus formation. Management: It has non-surgical endodontic therapy, and we can also do surgical management, and in severe cases when tooth is non-restorable we can do extraction. In case of radicular cyst, non-surgical endodontic therapy include root canal therapy that can resolve small radicular cysts by removing the source of inflammation, and in this case healing occurs gradually over several months with bone regeneration. We can also do surgical management that may include enucleation or marsupialization. Enucleation is complete surgical removal of cyst and associated tissue, and marsupialization is for very large cysts to reduce size before enucleation. Extraction can be done, and it is indicated if the tooth is non-restorable or if the cyst is associated with non-salvageable tooth. Prognosis of radicular cyst: Prognosis is excellent with proper management. Recurrence is rare if the source of inflammation is eliminated. Untreated cysts may enlarge, causing bone destruction, tooth displacement, or infection. Clinical significance: Radicular cyst is the most common odontogenic cyst. Early diagnosis prevents complication, tooth loss, and extensive bone damage. Management focuses on eliminating the source of infection either by endodontic therapy or surgical removal. Conclusion of this lecture video: Radicular cyst is a chronic epithelial-lined periapical lesion that arises due to pulp necrosis and chronic inflammation. Most are asymptomatic but may occasionally cause swelling or pain. Diagnosis relies on radiographs, Pulp testing and histopathology. Treatment involves endodontic therapy, surgical removal, or extraction with an excellent prognosis when properly managed. And this was all about radicular cyst. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.